Well, refugees in Germany have started setting up support networks during the pandemic. Shelters in the country have become centers of outbreaks with people living at very close quarters, even, they say, with those who are infected. DW's Bastian Hartig investigated the situation in the state of Bavaria.
Samba Ba is a regular at this textile store in Bad Tölz, a small town close to the Bavarian Alps. Samba is a migrant from Senegal. He comes here to choose the fabric for the face masks he makes together with fellow migrants and refugees. It's their contribution in an effort to keep the coronavirus at bay in the crowded refugee centers like the one where he lives.
In a room, you can have 4 people or 5 people in one room. They say that the corona can have in your body 14 days before it will soar. So you can have it and we are at the same place, we will not know. So then the whole place will get it. So we say this is the only way we can able to help them, to support them with the face masks.
Samba Ba is a member of a group of activists who help migrants and refugees all over Bavaria. Amid the pandemic, the group's special focus is on those who are in accommodations that are under lockdown because of COVID-19. Until recently, Ebu, also from Senegal, was under quarantine in a center in the nearby city of Rosenheim. On the phone, he tells Samba that people there are afraid of contracting the virus because those who are infected were under lockdown together with everyone else. We visit a migrant center in Rosenheim that was among the hardest hit by the pandemic. It's been under lockdown for some 6 weeks. The local public health authorities are here to tell the residents that although there are currently no new known cases, the quarantine won't be lifted for at least another few days. Some here are growing impatient. I haven't worked for a month. My boss calls every day and asks why I don't come in to work. I've told him we're under quarantine and I'm not allowed to go out. It wasn't until recently that those who had tested positive for the coronavirus were taken to a different facility for isolation along with their families after a month of quarantine. Simon Neuchel is a volunteer helper at the refugee center. He can't understand why authorities didn't act sooner. I think what was really needed from the outset was a plan for what to do if more than 2 or 4 people are infected. How can we accommodate people so they can live reasonably? In the schools, we're now dividing the classrooms up in a different way. There's been a change with physical distancing. Tables are empty. The same is true in beer gardens. But here in the center, everything's the same as it used to be. Many of the residents share bathrooms. Almost all of them share kitchens. It's practically inevitable that people are constantly getting infected. A spokeswoman for the regional government in charge of this and other centers says it has put sufficient measures in place to keep the refugees and migrants safe. We've informed the residents and the workers about how infections are spread. We use pictograms and put out flyers in different languages that explain hygienic measures that residents must follow, physical distancing rules, etiquette on coughing and sneezing, and why regular hand washing is important. There's disinfectant available. We're supporting the residents as best we can.
Wir unterstützen die Bewohner bestmöglich, soweit es uns möglich ist.
At Samba's accommodation in Bad Tölz, he and the other residents don't want to rely solely on the authorities. They say they've already made 26,000 face masks to distribute to other accommodations all over Bavaria. And they plan to keep going until their situation improves.